With hand sanitizer and face masks now commonplace, it's reassuring to know GSK's experts have always been proactive about hygiene. SERETIDE is manufactured under sterile conditions, which means that all of our factory operatives make hygiene a top priority. We take great pride in the stringency of our manufacturing processes, with robust quality control checks, ensuring every single device meets the highest standards of quality and hygiene. Not only are SERETIDE devices developed in a strictly controlled environment, state-of-the-art processes minimize the risk of human contact and contamination. The doses in our discus device, for example, are automatically measured out in a sterile chamber and the blisters individually sealed. Once assembled, all our inhalers are encased in foil packaging and the boxes are secured with a tamper-proof sticker. This means you can be sure that your patients receive a high-quality, sterile product. So, for proactive asthma control manufactured with care, choose proactive regular dosing with SERETIDE. Be proactive. Control asthma.
The simple substitution of budesonide Formoterol for SABA allows the dose of controller medication, inhaled corticosteroid, to be increased quickly in response to symptoms, while simultaneously offering rapid symptom relief with the LABA component. COMPASS, a randomized double-blind 6-month clinical trial, compared the efficacy of Symbicort maintenance and reliever therapy with that of a higher maintenance dose of ICS/LABA. Adult and adolescent patients were randomized into 3 treatment groups to compare Symbicort maintenance and reliever therapy versus a higher dose of salmeterol fluticasone plus terbutaline as reliever medication, and versus a higher fixed dose of budesonide formoterol plus terbutaline. The primary endpoint was met. Symbicort maintenance and reliever therapy prolonged the time to first severe exacerbation by reducing the risk of exacerbation by 33% compared with salmeterol fluticasone and by 26% compared with fixed-dose budesonide formoterol. Among the secondary endpoints, Symbicort maintenance and reliever therapy reduced by 39% the rate of severe exacerbations compared with a higher dose of salmeterol fluticasone, and also reduced the total number of hospitalizations and ER treatments compared with the fixed-dose salmeterol fluticasone. Moreover, this was achieved with a 25% lower mean daily ICS dose compared with salmeterol fluticasone. In addition, all 3 regimens provided similar improvements in daily symptom control and lung function. All 3 treatments were well tolerated, and there were no notable differences between groups with regard to the number or severity of adverse events. The most common adverse events were upper respiratory tract infection, pharyngitis and nasopharyngitis. In conclusion, compared with a 2-fold higher fixed maintenance dose of budesonide formoterol or a higher dose of salmeterol fluticasone plus SABA for relief, Symbicort maintenance and reliever reduces the incidence of severe asthma exacerbations and maintains similar daily asthma control at a lower overall drug load.
I do my best to manage my diabetes. Every day is a new day, and I strive to move forward. Especially since the outbreak of COVID-19, I am not taking things for granted. Of course, having the support of my loved ones is important. Today, I'm going to do something important. I am going to protect myself against pneumonia.
Pneumonia, was the second leading cause of death in our country in 2018. And adults with diabetes are more likely to develop pneumonia than others. This is because of their weakened immune system, impaired lung function, and damaged blood vessels in the lungs. Pneumonia can be caused by virus, bacteria, or fungi. One of the most common bacterial pneumonia is pneumococcal pneumonia, caused by Streptococcus pneumoniae. Fortunately, immunization and other preventive steps can help protect you from this disease. Consult your doctor to know more about pneumococcal pneumonia and prevention. Vaccination can help to save your life. Protect yourself and your loved ones. Speak to your doctor today.
I was hospitalized for pneumonia. The doctors thought it was caused by COVID-19, but it wasn't. But I still ended up fighting for my life. My lungs' air sacs became terribly inflamed and filled up with fluid and pus. I couldn't breathe. I was gasping for air. It felt like drowning.
Pneumonia was the second leading cause of death in our country in 2018. Most who are afflicted are the elderly or people with long-term health problems such as diabetes, heart failure, lung disease, or asthma. Pneumonia can be caused by virus, bacteria, or fungi. One of the most common bacterial pneumonia is pneumococcal pneumonia, caused by Streptococcus pneumoniae. Fortunately, immunization and other preventive steps can help protect you from the disease. Consult your doctor to know more about pneumococcal pneumonia and prevention. Vaccination can help to save your life. Protect yourself and your loved ones. Speak to your doctor today.
Now that we are not that young anymore, we have to take extra care of our health, especially since the outbreak of COVID-19. We cannot take things for granted. We have to watch our weight. We have to watch our step. And we need to watch out for infections, especially those that attack our lungs.
As we age, our lung function and immune system gradually become weaker. This is why many older people develop pneumonia. In fact, it was the second leading cause of death in our country in 2018. Pneumonia can be caused by virus, bacteria, or fungi. One of the most common bacterial pneumonia is pneumococcal pneumonia caused by Streptococcus pneumoniae. Fortunately, immunization and other preventive steps can help protect you from this disease. Consult your doctor to know more about pneumococcal pneumonia and prevention. Vaccination can help to save your life. Protect yourself and your loved ones. Speak to your doctor today.
Hello and welcome everyone who is joining us on this lovely virtual platform. I'm Pepe and here with me I have Zeno and Yenny. We are delighted to guide you through this exciting segment to unlock the potential of inhaled asthma treatment. Now, we need to imagine the world we want to create for our patients and for our families. In Novartis, we reimagine the management and treatment of asthma control. Now, I would like to invite Zeno to share with you about our purposes in Novartis.
Thank you, Pepe, and a big hello to all of you. We have two purposes: medical innovations and accessibility. Through medical innovations, we can reimagine asthma care with new advanced combination therapy. Moving on, let me guide you through platinum.
In Iridium, we observe additional advantages in advanced combination therapy. Superiority of NSA once daily, versus salmeterol fluticasone twice daily in lung function improvement is confirmed. I understand that exacerbation is an important treatment goal for all asthma patients. Let me assure you that Anazir once daily can help your symptomatic ICS-LABA patients in further reductions of exacerbations.
Do you know that Anazir provides comprehensive bronchodilations that produces better outcome compared to loose combination?
Absolutely! In Argon, Anazir once daily does not only provide better lung functions, asthma control, quality of life improvement versus loose combinations, but also providing 24-hour coverage with only once daily regime. PF improvement is consistent throughout 24 hours.
Yes! To ensure more patients can access to Anazir, we benchmark the cost to the current treatment. We want to achieve 2 times more patients, 2 times faster. We aim to transform more lives than we ever have.
Remember Anazir, remember excellence.
With Anazir,
let's reimagine asthma care with us.
前你有谁照顾你吗？你的家人？
我一个小女儿，以前呢是怕你有事没有人载你去医院啊。
对，以前呢你好像要去跟你的孙出去外面走走啊，去看你的亲戚啊。
没有，
不能啦。
不能，不敢去。
不敢去。比如说你讲你要出去啊，
就跑很近，
跑很近。
The emphasis endobronchial valve is an endobronchial prosthesis that is intended to control airflow. Designed to be a permanent implant, the device consists of a one-way silicone duckbill valve, precisely engineered to open at low pressures, but close quickly when the airflow direction is reversed. Through a standard bronchoscope placed in the trachea, the emphasis endobronchial valve is guided to the target lobe. Using a flexible delivery catheter, the emphasis endobronchial valve is deployed in the airway. The emphasis valve has a self-expanding retainer designed to conform to the bronchial wall and provide an airtight seal. The one-way valve is designed to prevent air from entering the most diseased portions of the lung, while allowing trapped air and fluid to escape. During the treatment, several emphasis valves may be placed within the diseased lobe. By controlling airflow, the emphasis valve is intended to reduce the volume of the targeted lobe, allowing healthier regions to function more normally. In addition, the diaphragm returns to a more normal shape and function, further improving breathing mechanics. In clinical trials, emphasis endobronchial valve treatment has demonstrated its ability to improve lung function in some patients with emphysema, as measured by a combination of physiologic and quality of life clinical endpoints.
OK， 然后晚上你要喷那个 nebulizer 吗？
没有就是有次他的药源而已。
之前你可以喷多少次呢？
他以前是给我喷2次。
现在完全。
现在没有喷过。
没有喷过。OK。And then 以前你可以深呼吸的，以前你不能呼吸，深呼吸不能。
太低太细就可以。
现在呢，深呼吸。
现在可以了。
深呼吸。可以了。OK。像平时好像在家做家务的时候呢，是怎么样的？之前的时候，
以前呢有5kg我们拿不起，就不敢，现在可以拿到5kg啊，而且10kg都可以了，还可以拿了。
OK， 我看到你可以自己加 lorry。
是啊，现在可以啊。
以前可以加 lorry 吗？
现在假如你那灯那个管那多啊，就喘了。现在没有了。
现在没有了。
可以自由加了。
哇 ，OK， 我看到了，我可以加楼梯。如果是上楼梯的话呢，你可以比喻一下吗？之前和之后，之前是怎样的？
以前是可以上到7个就不可以了。现在可以上到15，还可以加。
OK， 都2层楼啦。
2层楼。
OK。然后还有你冲凉的时候
以前很喘了。
以前很喘。
以前很喘，有时一咳嗽了，一冲凉一咳嗽就来，马上要出来就要靠那个氧气了。现在不必了。
不必了就
可以治疗了。
哇。你的情绪方面呢，比以前你讲吃的方面会怎么样呢？
吃的好像比较开胃一点。
以前呢？
以前呢吃不下。
吃不下，现在可以吃。
现在可以吃了。
然后心情会怎么样？
一样吗？
开朗哦。
是
OK。这样最后一个问题也没有了。就是你觉得这个手术
之前和之后啊，你满意吗？
之后很满意。
之后很满意。
我们很轻松，我们可以，我自己想去哪里都可以去哪里。
Two studies showed that 28% of asthma patients were misdiagnosed. 25% of all patients do not need asthma medication, and 55% suffer from uncontrolled asthma. We may have a solution to this problem. By using exhaled nitric oxide, or FeNO, as it is also called, a biomarker of airway inflammation, it is possible to better understand the situation. A recent study in a specialist setting with 50 asthma patients showed that by adding FeNO measurements to other normal standard assessments, 36% of the initial treatment recommendations were substantially altered, leading to an opportunity of better treatment of the patient. Regular FeNO testing of asthma patients with NIOX Vero measures allergic airway inflammation and helps to reveal if the patient will benefit from inhaled corticosteroid treatment, optimize ICS dose and reduce exacerbations up to 50%, and detect patient non-adherence to ICS while improving asthma outcomes and reducing costs. NIOX Vero is easy to use and gives quick results, gives reliable and accurate results. A service and maintenance-free device with no calibration. NIOX Vero can be used standalone or connected to a PC. This includes a visual incentive, NIOX Panel, during the procedure on a PC screen, and a program, NIOX Patient, allowing documentation of patient data and capable of use with electronic medical record systems.